the majority of my generation grew up wanting to exercise, wanting to ski, wanting to bike, doing all this exercise because we wanted good health our whole lives. We ate better, we took protein, we did all this stuff, right? And we paid Medicare. We paid this amount of money to Medicare that they could do whatever they want with it. I mean, I should try and figure out how much I put away, but then the government takes that money, they can do anything they want with it, but then they divvy it out to us and they tell us that we can only use it for certain things. But our whole lives, instead of going to the doctor, we've been doing massage, we've been doing acupuncture, chiropractics, hikes, all this stuff so that we wouldn't have to have all these things happen to us. And the end result is that we are being told, well, you can't use your Medicare on the things that have created this good experience, this good health for you your whole life, right? That pisses me off because really and truly all I want it for is those things. I don't want to go to the doctor every year. I don't want to have this test or that test. And every time you go to a doctor, for the most part anymore, because of their rules and regulations, they are always going to offer you a test. They're not asking you, how have you been? How's your life? Are you depressed? They do ask you if you're depressed or if you've had falls. Like, why? I mean, I understand for some people, but for the rest, there's so many of us that are so healthy. We don't want to have a surgery every time we need, that our knee hurts. We want better solutions. So we go outside of that into functional medicine, alternative medicine, all these other things to find the answers for that, to keep us healthy, and Medicare won't pay for it. Sort of contradictory. It's kind of like they don't really want us to be well. And and the constant, these pills. I see patient charts. I've been helping out at work extra this last couple of weeks. And so one of the things I've been doing is viewing people's charts, and I am shocked, absolutely shocked at how many drugs some of these people are on. And you wonder why they have kidney disease, upset stomachs, diarrhea all the time, all these things. And it's because we're inundating them with toxins. And that's the practice of medicine, not to keep healthy, right? That's what they're taking your money for, so that they can control you at the end on your health. So it's frustrating for me. And I think it's worth talking about and worth saying to your generation or the next generations, maybe, not that Medicare doesn't have a good purpose. It's that who says they can control it? It's just no credit for if you're healthy, no credit if you're if you're a non-smoker. It's just all they want when you go into the office is to sign you up for some other treatment. Like, when was the last time you had a mammogram? When was the last time you had a colonoscopy? When was the last time? I think you need labs. Maybe we should check your urine. No rhyme or reason to it. Just do it because cha-ching, cha-ching. I've met my quota. Next patient, please. So it's pretty frustrating. And I think that it's time to start saying something about it. If you like this video, you might want to subscribe and watch this video next. Thank you.